Good evening and welcome to Monday Night Meetup with the Office of the Victim Advocate. My name is Suzanne Estrella and I am the Commonwealth Victim Advocate. This is a judgment-free space for honest conversation, thoughtful reflection. There is no expectation of privacy. These conversations are being recorded. It'll be aired live on Facebook and later posted to our YouTube channel for people to watch at their discretion. So while we hope you will join us, we want you to know that there is no expectation of privacy, but we will respect the comments and the thoughts and opinions of those who are sharing. If you have questions and you're on Facebook Live, please chat them in the chat and we will try to address those questions as time permits. Tonight, please help me welcome my guest. We're going to be talking about therapy, and I am here with Dr. Sherri Humphries, who is a therapist, and she will be answering lots of questions for survivors tonight. And we are just happy to have this opportunity to have this really important discussion. So please, Dr. Humphries, introduce yourself to our guests, our audience.
Absolutely. Good evening. My name is Dr. Sherri Humphries, and I am a licensed professional counselor with a PhD in marriage and family therapy, and I have a private practice in the Willow Grove area of Pennsylvania. And I also work as a clinical director at an agency in Jenkintown, Pennsylvania. And I'm very excited to be here tonight to answer some questions and to talk about a topic that is obviously near and dear to my heart, and that is the art of therapy. So I'm pleased to be here.
Oh, great. Welcome. It sounds like you've got quite a few different aspects of therapy that you're involved in. So I hope that we'll get to hear some more of that. But just kind of for some groundwork, tell us, what is therapy?
Absolutely. That's a great question and a great place to start. Because we don't want to assume that everybody knows the answer to that. So when I think of therapy, I think in terms of treatment. So therapy is a form of treatment and it is designed to help people in general. So it can be for individuals, for couples, for families, for groups, and it can be to address any concerns, anything impacting emotional health, mental health, interpersonal interactions, anything that is interfering with someone's general health and well-being are things that we do. And therapy is services provided by trained professionals who use research-based, evidence-based techniques and practices to really just help people deal with their stuff, whatever it is that they are bringing to the table. We try to find effective ways of helping them better understand themselves, better understand others, and better understand the world around them so that we can help to promote positive change.
Okay, so how would you explain the difference between, let's say, therapy and a support group?
Good question. And I will say that's a great question. And I would say both are absolutely effective ways of seeking out treatment. I do want to say that because support groups have been found to be very, very helpful. So I'll talk about there's some similarities and then there's some differences. So when you think in terms of a support group, one of the differences are that support groups can tend to be peer-led. So often they're led by other people who have maybe the same issues or in recovery for some of the same things, but are not necessarily professionals in that area. So maybe did not go to school for social work or any kind of clinical aspect. So oftentimes they are peer-led. And then oftentimes support groups tend to be have a information base to them or a psychoeducational base. So you come to support group to kind of gather to talk about a particular topic. And so there's normally some kind of educational material handed out, some kind of issue or topic that they're discussing, right? And you come to the support group and the group members receive their support from other people in the group. So very group focused, group led. So when you come to support group, whether it is for Alcoholic Anonymous, you might go to a domestic violence survivor support group, I used to run a post-adoption support group. So people come with common issues, common interests, and they receive support for one another. The difference between that and therapy is there is not the element in a support group for you to receive one-on-one support from a professional. So you're not going to support group to tell your personal story and then to get help from one professional. You're going to share your story with the group, and then you glean your support from the group. And again, that can be very effective as well. But I think the difference is that they're generally peer run or peer supported, and there isn't that individual
Got it.
content to it.
Got it. Okay, so I think that I'm starting to maybe sense that some shifting is going on, especially since like post-pandemic with regards to therapy. But in general, I think there still seems to be like a stigma
Oh, yeah.
attached to therapy. And what would you say, what do you think is the cause of that, or why that's the case?
I would say, first of all, that I would think that that's definitely correct. I think that we have come a long way in the field of mental health. And yet I think we still have a long way to go to kind of chip away at that stigma. And I think that that stigma is attached not just to therapy, but to mental health as a whole and mental health issues as a whole. For whatever reason, I think they are viewed differently than physical health issues. Even though health issues are health issues, there is a stigma that tends to be attached with mental health issues. And I think the cause for that is maybe lack of knowledge, lack of awareness, and maybe just a misunderstanding of what therapy is and what therapy is for. And I do agree with you that I think we are chipping away at that. And I think we can still do better at helping to educate people and to get the word out there and get the message out there that therapy is for anybody. Therapy can be for everybody, right? And so I think we're moving away from this notion that therapy has to be for people that have some kind of severe mental health diagnosis, or therapy is for other people. And sometimes when we get into that concept of othering, we cut ourselves off from resources that we can benefit from, because in our mind, we're conditioned to believe that that's for someone else. And as long as we keep thinking that's for someone else, we cut ourselves off from being able to utilize those resources. So I think a lot of what we're doing is trying to do away with some of those misperceptions and get the word out there that if therapy is really about self-care or soul care, really caring for your soul, for your emotions, for your beliefs, your intent, your all of those internal things, then that's a human condition. We all have that. And so we can all benefit at times from having somebody to talk to care well for our own souls and for our own selves. And so I think we've done better, but we still have our work to do to kind of chip away at that
Right.
stigma.
You mentioned that kind of othering, like saying this is for other people, which kind of brings up something that I hear commonly amongst Black and Brown people. I hear them say that, and I probably have said it myself, if I'm being honest, that therapy is for white people. Is
Mhm.
that something that you hear amongst professionals or like other therapists that you work with? Do they hear that from people? And like, how would you respond to that?
Yeah, I think that and again, even though we've come a long way, I think that I know I still hear it. And I'm sure that there are other therapists and there are other therapist colleagues that I have personally that I know that they hear it as well, that there is still this notion in some of our Black and Brown communities that therapy is for white people, or white people go to therapy. And again, something that is probably generational, passed down through generations. And when you think about it, I can think about it more specifically from the African American community. When you think about growing up, there was this notion for a lot of us of kind of what happens in our house stays in our house, or what happens in our community stays in our community. Like, we don't go out, we don't tell our business, we don't share our business. And so when you get in the habit of doing that, or when you create that narrative and then pass it on, it just keeps getting passed down through generations. And so if we create this culture where we don't share our emotions, we don't share our story, we don't share our business, then we are left carrying the burden, because we're cutting ourselves off from the help that we could have if we were willing to cross that barrier. And I think we are seeing a lot more of this, breaking this down. And I think too, traditionally or historically, maybe what's happened is at one point, there wasn't a lot of therapists that looked like us. There weren't a lot of therapists of color. And so not only was therapy seen as what white people do, but the white people were the therapist. So if we're supposed to keep all of our business to ourselves, then I'm certainly not going to go to therapy and tell it to
No,
somebody
that's
who
true.
doesn't look like me, right? But now we're at a place where you can find a therapist that looks like you. And there are lots of us. So I think we are chipping away at that, and breaking down some of those barriers, but we do have a long way to go. And I think a lot of it just stems from a misunderstanding, and maybe again that stigma, and that sense of systemic and historical racial issues that have just been passed down. So I think in a nutshell, if I would have to answer the question, if somebody said to me, isn't therapy for white people? I think how I would answer that is I would probably say therapy is appropriate for all people, because therapy is about self-care, and we all need to care well for ourselves.
That's true. That's a good point. It kind of reminds me, I had a conversation with a fellow attorney, and he happens to be an immigrant from Poland. And I don't even remember how we got on the subject of therapy, but he said, we always say therapy is for Americans. That,
Mm,
immigrants don't have time for that kind of stuff. And it was so funny because it seemed like so similar to things that I've heard in my own community. And then there's another people group making another assumption,
yes.
that's so similar, but not having to do with color at
Yeah.
all. So yeah.
Yes, interesting. And I love that when when you said, he said we don't have time for that. I think that's another piece of it too, that in so many different cultures, like the concept of talking about your emotions and spending time dealing with your feelings is really not what some people haven't had the luxury to do that. We haven't had this space
Mhm.
or the luxury or the privilege at times to spend a whole lot of time, dealing with our thoughts, dealing with our feelings, because we're trying to survive, we're trying to live, we're trying to, make things happen for our family. And so we haven't had the luxury in a lot of cases and situations to spend the time or to spend the resources or had access to resources to help
Mhm.
us sit in these spaces. And yet, this is still such valuable work that needs to be done, because what we think, what we feel, how we interact with other people has a lot to do with who we are and how we interact with the world. So I think it's good that we're opening up spaces for
Mhm.
people of Black and brown color to think about, is this for me? Is this something that I want to do? And when I decide, yes, this is something that I want to do, that the resources are out there, that there's people that look like me now that provide this service.
Mhm. That's good. Now, of course, here at the Office of Victim Advocate, we are trying to find ways for crime survivors to build resiliency and find ways that they can move forward and find healing in their pathways to justice. So, with that kind of lens, would you think that a crime survivor should look for a particular type of therapist, or what advice can you give for how someone should go about choosing a therapist?
Yeah, I think that's an important piece. And I say all the time for everybody that, don't be afraid to shop around and to find a therapist that you believe that you can be comfortable with, because so much of the work that's done in therapy is based on the therapeutic alliance, is based on that relationship with the therapist and the client. And so that client therapist relationship is crucial. So you want to find somebody that you're going to be comfortable with. And the other thing I would say is when you're talking about crime survivors, we're also talking about trauma survivors, right? So being able to find somebody who's trauma informed. Now, of course, in this, where we are now in the field, that should be the norm. Like if you're coming out of school and you have the credentials and you have a license, you should be trauma informed. But sometimes maybe looking, if you're perusing websites and you're looking at people's profile on Psychology Today, you want to see something maybe in their profile that indicates that they've done trauma work, that they're trauma informed, because you want somebody that's going to be able to understand your survival through the lens of trauma and the impact that trauma has on relationships, on healing, on the brain, on all of that stuff. And so that's one thing I would say, to look for somebody who's definitely trauma informed. And then just knowing yourself enough to know, like, what are your preferences? Because you can shop around for your preference. If you prefer a female therapist, an African-American therapist, a therapist of a different race, a different culture, oftentimes on their profile, therapists will have their religious affiliation. So if that's something important to you, you can look for that. Some people feel like age is important. Like if the therapist is too young, they might feel like they're not going to understand my struggle. They're too much older than me, they're not going to understand my struggle. And so the way that people tend to market themselves now is they create a profile. So potential clients can read the profile, can see their pictures, can kind of make an informed decision. Does this seem like somebody that I'm going to gel with? Am I going to fit with this person? And of course, you won't know all of that ahead of time until you start to meet with them, but you can at least do that work up front, because you can know like what you feel comfortable with. And so I say to people all the time, even people that call me, I tell them about myself, and then I tell them I'm not offended if you want to shop around and find what works for you, because you want to make sure that you're comfortable, because you're going to be telling your story, and you want to tell your story with somebody that you feel comfortable sitting with in that space.
So is that kind of common that like a therapist would kind of offer like a free consultation, or like how
Mm-hmm.
does that shop around process work?
Mm-hmm. It is a common thing that now all therapists may not offer it, and some therapists might offer it as a discount rate, not necessarily free. Um, but a lot of therapists do offer free consultations. So you can call, you can ask questions, you can ask them, what treatment modalities do they use? Do they have any specialties? Like you can ask them questions to see if it's going to be a good fit for you. If a therapist does not offer free consultations, it's generally because they have a lot of information on their website, or on their material, wherever they whether it's on Instagram, Facebook, wherever your Psychology Today, wherever you found them, they generally have enough information on there that you can make an informed decision. But and you can always ask. I encourage people to ask, even if somebody doesn't have it listed that they do free consultations. If you're looking at their page and you're interested in them, you can always contact them and say, I'm shopping for a therapist. I'm trying to find a therapist. Would you offer a telephone call or a Zoom session that I can meet with you for a few minutes and see if this is a good fit? So I tell people, don't be afraid to ask. All they can say is, no, I can't do that. But most
Mhm.
people do offer consultation.
Good, that's great advice.
Mhm.
Um, so what can a person expect to take place on like the first day of therapy? And is therapy like something that you need to prepare for, or what does that usually look like?
Sure. That's another common question too. And sometimes I'll hear people say, like, I don't know, I'm not gonna know what to do. I don't know what to say. And I think that therapy isn't really something that you have to prepare for, because really you're bringing yourself, you're bringing your story, you're bringing yourself to the therapy session. And the therapist has already prepared. They've done the training, they've done the work, they have the skill set to sit with you in that space. So they've done their preparation, and all you have to do is bring yourself. And I would say the only thing that you have to do or bring is a willingness to engage in the process. And then I think when you come with yourself and a willingness to engage, then the process will unfold. And I would say, as far as what to expect in an initial therapy appointment, it really does depend on the therapist, because there is usually more paperwork initially than in subsequent sessions. So there may be maybe some assessment forms, some questionnaires, but again, nothing that you would have to study for or prepare for, because they're going to be about you. And you know yourself, you know your story. So there might be questions about like past history, trauma history. Have you been in therapy before? Is a common question that people have on their assessments. And so there might be some assessment paperwork that you do at the initial assessment. I know with my clients, I send out assessment paperwork ahead of time. So once a client schedules an appointment with me, I send them the assessment, and they send it back electronically. So then when they come to me for the first session, all that paperwork is already done. And again, every therapist is different, but what I do is I like to start with just open-ended questions. And so no preparation, no script, just tell me about yourself. Tell me what brings you in today. Tell me what you want me to know. I might start with something like that, what we call an open opening. So generally a therapist just has a way that they start a conversation, and then they just let it unfold from there. Because that's the beauty, I think, of therapy, is that it's just creating a safe place for you to tell your story.
Mhm. I'll say, I'll confess, I went to therapy for the first time during COVID. And honestly, I thought it was a little bit more work than what I expected, because I was like, okay, let me just go and say this, and then, she'll tell me what to do. That'll be that. But she kept asking me questions, and I
Yeah.
was like, what? Don't you just have the answers? And it was like so weird to sit there, and the person like she was fine with complete silence until you have more to say, and like I had to do all this talking, and just like talking about yourself so much to me felt like really weird.
Mm-hmm.
Like there's like no other, I guess, outlet where you just sit and
Nope.
talk about yourself.
There's no other relationship that offers that.
Yeah,
No
so
other
it was a
relationship.
little bit to get used to, I think.
Mm-hmm. And I think
Yeah.
that that's what makes it different. And that's also the beauty in it, because when you think about it, 45, 50 minutes to talk about yourself, this is a long time. We don't usually do that.
Yeah.
Because even if you're in a conversation with a really close friend, or somebody who even your partner, somebody that you really thrive with and you really gel with, it still tends to be a back and forth dialogue. You talk for a while, they talk for a while. You say something about yourself, they say something about themselves. But in therapy, it really is the person creates a space for you. So it's 45, 50 minutes of you. Tell me your story. Tell me what you want me to know. And we don't, in other circles and other spaces and other times in our life, get the opportunity to think that much about ourselves, to focus that much about ourselves. That's also what makes it such a great avenue for healing, because then after a while, if you're willing to engage in the process, it helps you to see things about yourself that you wouldn't see in just general conversation, right? Because that person is deeply listening, hearing, paying attention to not only what you're saying, but what you're not saying. So they're trained to hear you and to see you and to understand you in ways that people that you generally talk to in the course of your day are not. So it is different. It's a different type of relationship. It's a different type of conversation than you would have normally.
Sure. What would you say to a crime survivor who says, well, I tried therapy and that didn't work?
Hmm. Yeah, I would probably say I get that, because sometimes that happens, and sometimes that can happen for multiple reasons. It could be that the therapy didn't work with that particular therapist. It could be the therapy didn't work because that particular therapeutic intervention didn't meet your need. It could be that the style of therapy didn't work for what you wanted. It could be that you came with an expectation of something that wasn't met. Is sometimes we enter into um, the therapeutic relationship, people come and they have expectations. And when those expectations aren't met in their mind, this didn't work. It didn't work because it wasn't what I was expecting. And so there's lots of reasons why a person might feel like this isn't working for me. And what I would say to that is don't be afraid to try again. Maybe try again with another therapist, try another type of treatment. There's lots of treatment modalities. And it could be maybe that therapeutic model didn't work for you, that maybe there's something that the person was missing. Also, I would say the good thing about it is that the therapy is for you. So don't, even though the other person is deemed as the professional or has been trained to be the professional, the service is being provided for you. So I would encourage clients, don't be afraid to say, hey, this isn't working. I don't feel like I'm getting anything out of this. Can we try something different? Or, I've been coming for whatever, X amount of sessions and I don't feel like anything is changing. What do you think? What can we do about that? Like, don't be afraid to say that. Because you have to keep in mind, like, this is for you. And so it's not gonna, hurt the person's feel, or you're not being mean if you say like, this isn't working. I need to try something different. So I
Wow,
think
that's good
empowering
advice.
people, yeah, to speak up and
Yeah.
say like, this isn't working for me.
Yeah, I wouldn't have thought of that as an option. So that's good to know.
Mm-hmm.
Just be
Yeah.
honest with them.
Mm-hmm.
Yeah, cool.
Mm-hmm.
What's the general goal of therapy? Like, what should the expectation be? Like, I'm gonna go and then this should be my end result, or does that exist?
I think, well, I'll answer it this way. I think in a very general sense, when I think of the goal for therapy, the word that comes to my mind is healing. I think the goal of therapy is healing. Similar to if you have a physical health condition and you're going to the hospital or you're going to the doctor on a regular basis for treatment, you're going for the ultimate goal would be healing. Now, sometimes within that healing is maybe medication to control symptoms, or maybe physical therapy. Like within that process of healing, if it's a physical condition, there are several things that you may do, but the ultimate goal is to be healed, right? To feel better, to be better, right? And so when I think of the goal of therapy, I think in that same sense. The goal, the ultimate goal of therapy is healing, wholeness, restoration, recovery. Right? People come in with an issue because they want to be healed. They want to not just feel better, because sometimes we think the goal might be to feel better, but I would challenge that. I would say that the goal is not to feel better. The goal is to be better, to actually be better, to get something out of it that is going to then change your life in a positive sense. So I would say that the goal is healing, and that takes on different forms. So it might be a decrease in symptoms, it might be an increase in self-awareness, it may be a change in behavior, it might be an adjustment in your personal beliefs. But the ultimate goal is to step you toward healing and wholeness so that you can live more whole, effective, better quality of life.
And is there like a time frame of like how long you should expect to be in therapy, or
I
how's
think
that
that
work?
that question, I think, would all depend, because there are some therapy models that have like a recommended time frame, and then there are some that are more open-ended. So if you're going to see somebody and they do more of a psychodynamic form of talk therapy, that tends to be kind of more open-ended, and you kind of just keep going until you feel like you're done or until you move towards closure. If it's more of like a brief solution focused therapy, then that normally is prescribed for a certain amount of, it might say like 6 to 8 sessions or 6 to 12 sessions. Or if you're going in for like emotionally focused therapy, that tends to be like a 12 session protocol. So it really all depends on the treatment modality that the person uses. Some of them are more open-ended, some of them have more of a prescribed length of time.
Now, is that something that like a crime survivor who's like engaging a therapist, is that something that the therapist would tell them, like, I'm going to use this modality? Or is that something that people should ask about? Well, what type of therapy treatment is this? Or is that, how is that?
I think that's a great question. And I think that's kind of a both end thing, because I think it can be both. And so a lot of times too, again, getting back to shopping around, sometimes on people's page, it will say, like, I specialize in this particular treatment modality. So it may say, I offer emotionally focused therapy, or I offer cognitive behavioral therapy. Or you might have somebody that says, I use an integrative approach, combining, and then they might have all the different types of therapies that they use, and they kind of integrate and pull from various things, all depending on the needs of the client. Generally, that information is somewhere in that therapist, on their website, on their Psychology Today profile page. That the information is normally somewhere. They
Okay.
may disclose that too in the initial assessment. This is generally the type of therapy that I use. They might give you some psychoeducational information up front about what that is and how it works and how many sessions it normally is. If they don't, you certainly can ask, like the client can ask, well, what type of therapy do you normally do? How many sessions would it normally take? That is certainly information that you can ask up front.
Okay, good. So I'm thinking it might be helpful if someone has like tried one thing,
Mm-hmm.
and then if they're going to try something else, then they may be able to say, well, I already tried that type of treatment, I'd like to try something else.
Yes.
So,
Mm-hmm.
okay, great. So it's
Yep.
information that
Mm-hmm.
survivor would have. That's great. Okay.
Absolutely.
Now, what do you think about therapy via Zoom, post pandemic, I guess during pandemic as well, and other like media platforms?
Mm-hmm. It's so interesting because prior to COVID, I never saw myself as doing like telehealth or doing sessions on Zoom. I always
Mhm.
did therapy face to face, in person, never really thought about doing it any kind of other way. And then here comes COVID and changes everything. And I think now, even when COVID started, I was just like, I don't think I want to do that. But now, having done it for a while and being able to see the benefits of it, because it does in some ways increase access for people. It makes it easier for people. For some people, now I have some clients who still prefer in person, but for some people I've heard that it takes away some of that barrier or that stigma of going to therapy, because they're in their own
Okay.
space, they're at home, they're comfortable in their own surrounding, and they're logging on and having a conversation with you. So it takes away that barrier of having to go to the therapist's office. So I think for some people it's been very helpful. Now, having done it, I don't see myself ever again not doing it. So I don't see myself going back to only in person and not doing telehealth, because I think it just increases the access so that more people can have access to what they need. And I think there's a lot, technology has come a long way. There's a lot of like secured platforms and HIPAA compliant platforms that you can use that make it safe, that make it a welcoming space for clients where they can feel safe and secure.
That's great. That's good to know. Have you seen like an kind of like an increase in people requesting therapy since the pandemic? Like, combined with everything else that's happening, has that been a big?
Yeah, I think so. I think, and too, with people But some people now, other people's schedules have changed as well. So now you have some people who used to leave their house every day and kind of be out and about. And now if they're working for home, it makes more sense for them too to do their sessions at home because they're already at home. Whereas opposed to them being like out and trying to come in before work, after work, or something like that. So I think, and then I hear people saying that they like it just doesn't feel the same to them. Like they need that in person, um, like contact. They need to be in the room with somebody to really create that therapeutic alliance. And that's another thing that for crime victims or for anybody who's seeking therapy and shopping for a therapist, that's absolutely a question that you can ask. Do you do in-person sessions or do you do telehealth sessions? So that if you have a preference, you make sure that you're connecting with somebody who can meet your personal preference.
Right. I've been hearing quite a bit lately about art therapy and music therapy. Can you tell us or talk a little bit about that?
Yeah. So those are great. Remember when we were talking a little bit about forms of treatment and treatment modalities, art therapy, music therapy, and then for kids, play therapy is another one for children. Those are different treatment modalities. And people who specialize in art therapy and music therapy generally have an additional training certification in either art therapy, music therapy. So they've gotten some other specialized training to help them in that. Now, the interesting thing is what I think is fascinating with music therapy is that it works for, it's been proven to be effective for a lot of different people with a lot of different issues, maybe anxiety, trauma, all kind of diagnoses, and you don't necessarily have to be musically inclined to benefit from it, but it does involve, because it involves listening to music, playing music, writing music, just engaging in the musical process, but you don't necessarily have to be somebody who is musically inclined to benefit from it. Same with art therapy. So art therapy is about tapping into those creative techniques like drawing, painting, coloring, sculpting, but you don't have to be an artist to benefit from it. Like you don't have to have like excellent art skills in order to be in art therapy. It is just a way to help people express what they are feeling and experiencing internally, as opposed to traditional talk therapy, where you're talking about all of your emotions. These two modalities give you a way to explore those things in other ways. So in music therapy, you're exploring it all through music. In art therapy, you're expressing it through art, as opposed to talk therapy, where you're just talking about it. So all have been proven to be very effective.
So that's good to know. So if you just don't want to go and sit and talk about yourself
Mm-hmm.
for 45 minutes, but still feel like you kind of need some help building resiliency or healing from trauma, then one of these other types could be very effective for you because it doesn't involve the talking piece.
Absolutely.
Wow, that's really good to know.
Absolutely.
And
Yeah.
then so when you talked about shopping around,
Mm-hmm.
can you just kind of give like a general of like, does somebody just Google, like, what would you suggest if somebody's like starting from scratch and they don't know where to look, how to look, what should they do?
I would say if you're starting from scratch and you don't know where to look and you haven't been like directed or referred to anybody, I would say you can start with your geographical area. I think that's a good place to start. So you can look for a therapist in your geographical area. If you don't want to just, some people don't like to just Google something because they think any old somebody might pop up. So if you don't feel comfortable enough to just Google, you could always go on Psychology Today and you could search for a therapist in your area. And sometimes you could put like your city or your town or your zip code, and then it'll give you a whole list of people that are in your area. I think that's a great resource, a great way to do it. And there's other, that's just Psychology Today is one. There's all kind of other sites that you could Google. If you know, like say you're an African American and you know that you are looking for an African American therapist, sometimes there are particular sites that you can look for. You can Google for African American therapists, and then different platforms or sites will come up and you can scroll. And again, put in your zip code and it'll pull up. If you're looking for a Christian therapist, you can do the same thing. You can Google like Christian therapists in your area. And then if you put your zip code and stuff in, it'll give you a list, and it'll generally connect back to people's profile or their Psychology Today page. So there will be other ways to like check people out and verify to make sure that their credentials are legit. Once you pull them up on Google, it normally directs you back to something else, to another source.
Great.
But I
Great.
say start with your geographical area if you're not sure where to look, because at least that way, if you're doing in-person sessions, you want it to be convenient. So you don't want your therapist to be so far away that it then becomes cumbersome for you to get there.
Mhm. Great. Well, this has been great information. You've shared so much, and we haven't had any questions come in from the chat. So we're going to get ready to wrap this up, and would love for you to just kind of give any closing remarks that you think would encourage crime survivors in helping them to kind of maybe take that leap and go ahead and start some therapy as part of a healing journey.
Yeah, I would say, first of all, I would say that to be encouraged to know that healing is possible. Because I think one of the crucial parts of therapy and one of the key parts of therapy, whether it is traditional talk therapy, one of these other treatment modalities, if it's group therapy, if it's support group, whatever it is, a key part of it is installation of hope. What we do is instill hope in people that healing is possible, and healing and change is possible for everybody. And so what I like to say to people is it doesn't matter how long you have struggled, it doesn't matter how deep the wounding has been, that there is healing available. And so I would encourage you with that. I would instill hope and say, yes, there is hope for your journey. There is healing available for you, and there are all kinds of treatments available. So even if you feel like you have tried before and it didn't work, I would instill hope by saying, try again. And maybe try a different therapist, try a different program, try a different approach, but try again, because healing is available for you. And there is all kind of research out. There is brain research out, neuroscience research that supports the fact that people can and do heal from trauma and heal from painful, hurtful things that they have gone through. So I would encourage people to not suffer in silence and to reach out and to find the support that they need.
Thank you so much, Dr. Humphries. That was powerful closing and so inspiring. And I know that it's meaningful and impactful to crime survivors. And we're just going to keep continuing to move forward and help people find their path to healing and hope and justice. So thank you so much for sharing this time and this space with us in this conversation. Up on the screen is our announcement for next month. June is Gun Violence Prevention Month, and we will be talking to some victim service providers who are working on providing healing from gun violence and reducing gun violence in their local communities. So we'll hope that people will be encouraged to be a part of that conversation and tune in June. So thank you so much. And again, this will be posted at a later time to our YouTube channel so that people can review and listen again. And if you had questions and didn't get a chance to submit them, please feel free to contact us at the Office of Victim Advocate, and we can make sure that we can assist you in finding the therapist or getting some information that you need. Thanks again, and have a good night.